right, Basel. I don't think you need any introduction, Basel. So you're going to give us the latest update on the HPV vaccine.
Yeah. It's about addressing HPV vaccine myth, practical information for healthcare providers, because as we have seen yesterday, there are still some concerns about the vaccine, about the cervical cancer prevalence, and if we need this vaccine or no. So I'm going directly. So I'm going directly to address this myth or this misconcepts and try to say why they are myths or considered misconceptions. So we have 5 common myths and misperceptions about HPV vaccination and how we address it. Myth number 1, or the questions that we are usually asked about it: HPV vaccine were only tested against pre-cancers and haven't been shown to prevent cancer. This is a question that's usually asked. And what is the background of this question? That some clinical trials supporting the license of HPV vaccine used the endpoint of HPV infection and precancerous lesion or abnormal cytology and not directly measure the reduction in HPV-related cancers. And the other point is that the vaccine is considered to be a new vaccine. That's what we hear sometimes up till now, and hasn't been tested long enough to show reduction of cancer. So that's something that we face. And simply because HPV-related cancer can take decades to develop, the initial clinical trials were conducted using precancerous as the endpoint, and continued monitoring for over more than a decade of vaccine right now use have already found decrease in HPV cancer rate in those who have been able to get vaccinated. It is not a new thing anymore. It has been more than a decade or 20 years right now. And it has been estimated that proportion of cytological abnormalities regressing to lower grades or absence ranging from 57% for cervical CIN1 to 32% CIN3. However, the same review documented that where only 1% of CIN progressing to invasion, 12% of CIN progress to invasion, and preventing those high-grade lesions eventually will lead to interrupt the natural history of HPV-related disease and cervical cancer. The question number 2 is, we have pap smears already, so why we do need HPV vaccination? It is enough to have only the pap smears, because pap smears are effective means, as we all agree, of identifying cervical precancers to trigger treatment. Some have argued that they have a better means for cervical cancer prevention rather than vaccination. And we can answer that pap smears have been very effective at reducing cervical cancer rates in the US, but HPV vaccination can prevent much more cancers than just cervical cancer. We are speaking about vaginal cancer, vulval cancer, benign cancer, anal cancers, and oropharyngeal cancers increased lately due to the oral sex, and also can prevent the precancers that we look for when doing pap smears, which can lead to less need for treatment of these precancers. Myth number 3 is HPV vaccines are not safe. This is something that I hear myself, and I had got a call from Germany, from someone from Germany who was saying for me, please don't propagate for the vaccine anymore. It is not safe, and it hasn't been sufficiently tested. It was raised the concerns about the safety of HPV vaccination have focused on death following vaccination, autoimmune and neurological function, and premature ovarian insufficiency or ovarian failure. I have heard myself that this vaccine is done for the region only, for the Arab region and the Muslim region, to do ovarian failure and just to stop reproducing. And of course, this is a myth. HPV vaccine were tested in clinical trials of tens of thousands of participants before they were approved for use in the USA. And since 2006, when HPV vaccine was licensed and recommended, there has been many larger studies ranging from hundreds of thousands to over 3 million people evaluated that continue to confirm the safety of HPV vaccine. While there have been deaths reported to CDC after HPV vaccination, these have been investigated thoroughly, and there is no evidence that the vaccine led to those deaths. In large study, over 2 million adolescents and young adults who died within a year of receiving any vaccine, there was no consistent pattern of death after vaccination, and there was only 1 adolescent who died within a month of receiving HPV vaccine. Really, what we do, that we don't have for the safety profile from WHO anything for vaccine unless for some fatigue and dizziness related to the injection itself, not for the vaccine. And that event when happened in Japan, the vaccine really was banned in Japan for 3 or 4 years before doing all the safety studies, and all the results said that the vaccine is not the cause of death, and now the Japanese are still vaccinating their girls again after stopping for 4 or 3 years. Now for more than 2 or 3 years, it returned back to the vaccination program in Tokyo, so this have to stop. We have to stop talking about this. Early ovarian insufficiency is more common than you might expect, affecting about 1 in every 10,000 young women, and in a study of almost 200,000 young women, 46 developed ovarian insufficiency. None was associated with HPV or other vaccines. It is not related to vaccine, it is something that's present among adolescents. Myth number 4, HPV vaccines are unnecessary because most people clear HPV naturally, and we totally agree for that, because estimates from HPV natural history research have identified that approximately 90% of new HPV infection are cleared by the immune system. We agree for that. Within 2 years, the need of HPV vaccination have been earnestly called into question in favor of natural immunity. But simply, we are lucky that our immune system can do such a job for clearing HPV infection. 90% of these infections are cleared by this way. However, HPV is such a common infection that even at this high level of clearance, there are still many women who can't clear HPV on their own because we don't know who will or who will not be able to clear HPV on their own, and that's why we want to vaccinate all adolescents to keep them protected. The last myth is that 11 to 12 years of age is too young to vaccinate. Children are not even sexually active, so why do you give the vaccine before the age of sexual activity? There are concerns about whether vaccination at this age will last long enough to give immunity for those patients against HPV infection. And second, HPV is most commonly spread through sexual activity, so why we give in this age before sexual activity? And third, that concerns have been raised that early vaccine send a message that adolescents can have permission now to go for sexual activity and do like that. Of course, clinical trials have documented that for both males and females, recipients of HPV vaccine prior to 15 years old or of age results in HPV antibody titers approximately 2-fold higher than when vaccination was provided at 15 years age or older. Those findings, along with clinical trials, show sustained high antibody titer following 2 doses of HPV vaccination given at younger age, led to the recommendation that we before 15 years old, we give 2 doses of vaccine, and after 15 years old, we give 3 doses of vaccine. Now the WHO permits that we can give only 1 dose of vaccine before 15 and 2 doses. So the earlier we vaccinate our girls, the longer the immunity and the higher the antibody tests in those individuals. Number 2, that HPV vaccine is most effective when given prior to the onset of sexual activity. Before sexual activity, you shouldn't wait for the female to have sexual activity and gut infection, and then after that vaccinate. So data from the National Survey of Family Growth estimates that 11% of the females and 16% of males will have sexual debut by 15 years of age. This is in the Western world, I agree, but still we are not so conservative as we imagine. With the average age at first sexual intercourse at 17 years, vaccination before 13 is important for that. And finally, that the idea that 11 to 12 years of age is too young to vaccinate because the child is not at risk of sexual activity is related to the idea that motor vehicle crash is low. It is unnecessary to wear a seat belt prior to being involved in a car crash. We all wear seat belts before having the crash. We don't wait for the crash. HPV, while being the most common sexually transmitted infection, and it is all the debates that we usually hear in all our region, that we are religious countries, we are conservative countries, we don't have sexual partners, we don't have sexual activity, and I usually debate, no, we are not that conservative as you imagine. We are not that conservative in the region, in Egypt or in Tunisia or in Morocco or in even Turkey. This is something that we try to convince, but even so, HPV is an epithelial virus, can be spread by skin-to-skin contact, not requiring sexual intercourse or fluid transfer. Now we have other methods of transmission rather than sexual. They are non-sexual contacts like digital genital contact, fomets including ultrasound wounds, and those of all plastic laser doing things and removal of the hair devices, reusable spicula, and shared clothing. You can just wear clothes in a shop or something like that, and you can get HPV just before trying that. So conclusion, time and time again, the safety and effectiveness of HPV vaccination has been confirmed through well-conducted research. However, the spread of misinformation through social media channels can overwhelm efforts by public health and medical practitioners to address those misconceptions, and it is worst when those misconceptions are propagated and delivered from healthcare providers, really, and thank you.
Thank you, Basel, for keeping the time and for the nice message. So the message is gender-neutral vaccination, safe and as early. Basel, you have a question?
Dr. Basel. First of all, I'd like to congratulate the great gathering, high caliber scientific meeting. Thank you, Basel, for inviting me. You are always doing a great job. My question related to how we can increase or raise the orientation in our population regarding the vaccine is, as you tell, the 10 myths daily facing, it's harmful, no longer term toxicity known, etc., etc. Why we are in a population with a strict sexual intercourse through the husband? Why? How, in your opinion? This is the first question. The second, is there any need for vaccination of cancer cervix patient?
So, first of all, thanks for being here, Professor Lubna. It's really a pleasure. And if anyone has comment about the well design the agenda and the scientific content, and because I am in the picture going here and there, but really because of the MEMAGO group from the Turkish side, from the Lebanese side, from Jordan, from Emirates, they all helped me. They all did everything. I'm in the image. So thanks for all the MEMAGO group, Mehmet and Mohi and David, and for everyone. For answering the questions, the first one is that why all this myth? Really, the main barrier for the spread of vaccination in Egypt, and I believe in the region for long, has been the healthcare providers, not the population. The population know nothing about the vaccine. What happened, and the stories that I have said several times, that what happened, we meet every day cases of advanced cervical cancer, me as oncosurgeon, not gynecologist, I meet cases stage 3 and 4 every week. They are all advanced, so I just thought of vaccinating my daughters. I have 2 daughters, and I thought of vaccinating. And simply, I asked my colleagues from gynecology and pediatric, where can I get the vaccine? No one could help me. Where is the vaccine? We don't know. And I went through for 2 or 3 months to find 2 doses for my daughters, first dose for my daughters to vaccinate. Once I vaccinate, I posted on Facebook that if you need the vaccine, you will find it in the institution of vaccination in Egypt is present. What happens that I got dozens of comments from the healthcare providers. What is this vaccine? Where is this? What you are speaking about? Is there a vaccine against cancer? So I start posting about what is the vaccine and what is everything, till I got MSD. I found them coming to my office, and their director told them, there is something strange in Mansoura. People in Mansoura are asking about the vaccination. What's wrong? And they know that someone who is active on Facebook, as usual, is writing about this vaccine, and that starts the story with the vaccination. But it started by vaccinating my daughters. So people told me, we are conservative, we are Islamic countries, we don't have multiple sexual relationships. I totally agree, but still, from the religious point of view, if you speak about Islam, for example, you have the right to marry 4. So you can simply marry 1, 2, 3, 4, and the second one can bring you HPV. This is an issue. Second, we have dozens of people who live away from their wives. They can be in Gulf region, in whatever, and they can be married, like Mohi is married for 5, for example. Okay? And then the last thing that I told them, yes, I grow up my girls, and I know how they are raised, and I guarantee they have good behavior, but I can't guarantee the behavior of their future husband. Even he is a good man, but he can be married before and then divorced, and he got here after his first wife. So I can't guarantee what her future husband is doing. And even let me go more. I'm not to punish my daughter if she did something wrong. I have to raise them. I have to give them some morals, and then they should go through. My role as a father is to protect my daughters, only to protect. Even if they do something wrong, I have to protect, not just to keep them. So I just have to protect my daughters. That's what I say to people, and that's what we have now. One of the longest series ever of vaccination in Mansoura, like more than 3,000 girls vaccinated in Mansoura, and propagated now what we are doing. This is the first question. For second question about cervical cancer, I don't have data to answer that. I don't believe after cervical cancer yes, after HPV infection, we can give the vaccine. This is the answer. If someone got infected with HPV, even with CIN 1 or 2, we can give the vaccine after that. This is clear. But after having cancer already and doing the surgery or radiotherapy, I don't have data on this, and I don't believe it to be of value.
We have data for precancerous. So if you have CIN2 plus or CIN3 and you treat them and you vaccinate these people, you decrease the chance of recurrence. There is no doubt about it. And lots of data on the progression of CIN3 to cancer. I mean, there is only only a single trial, which was an unethical trial that shows if you don't treat CIN3 the chance of recurrence for those treated are 50 times more over the next 30 years. So there is no doubt about the efficacy of the vaccine in treating, but to patients who already have cancer, to give them, there is a lot of therapeutic vaccine trial. These are preventive vaccine. One of them is called the Inovio, which is a therapeutic vaccine. But because people now are working more on preventive, they stopped really working on the therapeutic vaccine, which are totally different types.
Hi. Is there any evidence for us to suggest a girl who has been vaccinated, fully vaccinated with Gardasil, to suggest that girl 9-valent vaccine?
Yes. Up till now, we don't have answers for this question up till now. But what I have the answer sometimes, if someone got one dose of the tetravalent Gardasil vaccine, can we go and have the second, third dose from 9-valent vaccine? Up to my students, I say yes. You can have. You shouldn't go from the start and have the 9-valent. What?
Farouk has the answer.
Farouk has the answer. So please go for.
He gave us the lecture. Farouk.
Yes.
He gave the lecture the first day.
I was around.
Thank you. Mutlu knows the answer, but again, repeat the question, please.
In order to emphasize, I have already asked this question.
Yeah, one person is vaccinated by Gardasil.
A girl who has been fully vaccinated with Gardasil, is there any evidence for us to suggest her to have 9-valent vaccination?
Non-valent
Yes.
HPV vaccine. Yeah. For the cancers, she has additional 20% benefit. For the precancerous high-grade lesions, 30% additional benefit. Because of that, for girls, it is cost-effective vaccinating with the non-valent vaccine again. But the man and boy, we cannot say exactly the same benefit because almost 5 to 10% benefit only for man and boy.
Actually, what I'm going to ask is something like a comment, or because you know my opinion. In our center, we had cases of vulval cancer, even more.
Voice, please. Raise your
We have
voice.
cases of vulval cancer that are more than cervical cancers. And I want to know your opinion about the vaccination. Can it protect against vulval cancer? And I think the non-sexual transmission of HPV, and in our locality, maybe there is some predisposition for vulval cancer more than cervical cancer. The second question is that what about the boys for HPV vaccination? Boys, for boys, not only for girls.
Boys, yeah, I answer that. So, for the first question, I think for gynecologists, vulvar cancer is strongly related with HPV too, and protecting from HPV will significantly, for sure, decrease vulval cancer. So, if it is common in Upper Egypt and Asyut, so for sure they will be protected by HPV vaccine. For the non-HPV cervical cancer, I hear it several times, but what usually I say to the gynecologist, we need to interpret that into data, true data, like the ovarian cancer consensus. You have to go and do real data. Up till now, we have the papers published from Egypt, which are, I myself doubt the accuracy and the numbers, and they were done on like 1,000 women or something like that. It says that HPV prevalence is from 10% to 14%. That's what's published. This is not very high quality publications. However, this is what we have. If our dear gynecologist sees that it is much less, please do that and publish in Q1 and Q2 journals, and then we can say that the situation in Egypt is different. Maybe with a screening program, it's okay. For second, for boys, yes, for sure, as we say, boys and girls should be protected. Boys should be vaccinated because they don't have the warts and everything. So to protect their partners and to protect themselves from penile cancers and from oropharyngeal cancers. So we have to vaccinate both boys and girls at the age of 11, and that's it.
Thanks, Dr. Basel.